thank you again, Dr. Gordon, and I'd like to ask you one last question, if I may. And that is, in anti-aging medicine, of course, a lot of focus has been on growth hormone. Growth hormone, of course, as an injectable form, remains difficult, remains expensive, troublesome. What have you done to help people with their own growth hormone situations?
I learned early on that if we could get all of the mercury and lead out of your body, that you had a lot better levels as you age. And it's so key to understand that when people reach 90 years of age, many of them cannot open a door.
Right.
And that's due to loss of muscle. We have a big name for it, sarcopenia.
Mm-hmm.
So I at age 76 can't believe that I actually have more muscle than I did at age 29.
Fantastic.
But that's because I've overcome all these problems that I've had, and I've built myself a new body, and I've got a new heart. But I cannot do it all without a support product that allows me to sleep much deeper. When I take 3 of these tablets at bedtime, and my women patients take 2 at bedtime, you are going to sleep better, because this is growth hormone support. It is not growth hormone.
Mm-hmm.
This is just giving your body the building blocks that lets it work more effectively. There's things in here like tribulus that anybody can read about, and there's things like mumio that you don't know very much about, otherwise known as shilajit, but these are interesting substances. And then we have hypothalamic factors in here, which are all designed naturally to raise your body's own ability to release the growth hormone, because we didn't ever actually stop making it. It's just that we weren't releasing it. So I found this to be a little easier than sticking myself every day with a growth hormone shot, which is useful. And it certainly helps people, and I will use it on people who are in deep trouble. But I will only use it to kind of let them know how it's possible to come back to life and have some muscle and have some bone. And so I like growth hormone, but I like natural growth hormone support that's based on my lifetime program of being on oral chelation and zeolite and fiber and the rest of it. So I'm always taking the toxins out, because our pituitary, right up here in the center of our brain, is the master gland. And that gland, like all the glands, has a high level of fat. Glands tend to be fatty. That's why so many people have thyroid areas, because we have these toxins that concentrate in those glands. So now I'm supporting the natural function of your own gland, and you wind up, if you're an athlete that is doing any repetitive work of any kind, whether it's weightlifting or you're running a 1 mile distance, whatever you're doing, at the end of a month, you will beat your own records without fail. We have never found somebody who, taking this for a month, doesn't become absolutely using this the rest of their life, because they now see that we gave them a whole incremental improvement in their own body's muscle function by giving them natural growth hormone support.
That's fabulous news, and it's going to be of great interest to a lot of people. And Dr. Gordon, I'd like to thank you for your time. Is so valuable. You're in demand all over the world, and I thank you so much for taking the time to come into the office today. Thank you very much, Dr.
My pleasure, Pete.
Thank you.
Thank you, Phil.